Yes, it does, Daria. uh, Let me get my sound check and get my yes, it does. Daria. Let me get my sound check and get my. There you go. Hello, everybody. How y'all doing? This is an off-topic, off MGTOW subject. This is an off-topic for me. I've been looking at the. Ooh, I'm falling apart here. Yeah, there we go. I've been looking at the California's teacher strike. Sorry about that. And there seems to be some lack of logic in these people, even though these people are some of the smartest and the best and the brightest people in our communities, teachers, highly educated. You have to have at least a bachelor's degree or up to be a teacher, and some of these teachers go from bachelor's degrees up to doctorates, and most of it in a school you're going to find at least probably 2 doctorates, and you're going to find a bunch of master's degrees and a bunch of bachelor's degrees, and you're going to find subteaching assistants and stuff like that, and it works its way down to the janitor, and the janitor has to have some sort of education himself, because he has to deal with bloodborne bacterias and children throwing up, and he has to be an electrician, he has to be a maintenance man, he has to be able to fix pipes, so he's highly educated in himself. I've had some of those jobs in my life, so I kind of know what it takes to do these jobs. Hello, Joe. Hello, Daria. Hello, everybody that's going to listen in. Maybe not too many people on this Wednesday afternoon, but I'm just going to talk about healthcare and teaching. I'm going to talk about teaching, and I'm going to talk about healthcare and how these two things sort of solves itself. 2 of the biggest issues in our community is healthcare and teaching. In the California teacher strike, and some of you may live in California and be witnessing the California teacher strike, but years and years ago, I had the opportunity to sit in as an assistant in one of these union strikes, and that's what I did. I was a union person for a little while, and for a long time actually, and I had to sit in as an assistant, and the arguments were made. And one of the arguments that were made by the in the same argument came up. It's like, why don't we have nurses in the school for the children? And this is where and with this argument, it unfolds into our community. It unfolds, these ideas unfold into the bigger society. And why don't we have the nurses? We had nurses, one, and I know we used to have a nurse in the shop too. It was a very large shop, and men often get hurt, so they needed to go down to the nurse, and they went to the nurses building and everything. But they did away with that because we have emergency services, and emergency services and nursing are 2 different things. But for this argument, we'll say, why don't we have nurses within schools? We should have at least 2 of them. I'll agree with that. But in that question, it asked the question, if we have a registered nurse and we have a nurse in a school with some assistants or whatever it is, then we have a healthcare facility. What is needed for a nurse to be a nurse? You have to put it in a healthcare facility. And I'll agree with that. Put it in a healthcare facility. Most schools have rooms dedicated with beds and little things. It's a nurse without a thermometer is not a nurse. So we must put in the equipment that's needed in these things, and it becomes more cost. But the argument doesn't change for me. The argument in itself is we have educators which have doctorates, master's degrees, and bachelor's degrees, which in those things I know, because I've taken a lot of those courses, include nursing courses, CPR, healthcare, bloodborne bacteria, and all the things that are necessary for you to be a teacher in school. The minimal teaching degree at a preschool level demands the teachers have CPR courses, early childhood development courses, demand certain things that are similar to nurses. So the teachers in a 6th grade, 8th grade, 9th grade, 10th grade, as your education up to a master's degree or even a doctorate. Doctorate says something for itself. That doctor, that person that runs that school, and you may have two of them in each school, already have nursing degrees. Yes, they do. So, do we have nurses already in the schools? Yes, we do. They just have to search for them and look around. Anytime I go into a school, I can and ask people what they've done in their lives, and uh, and I look around when I look around the teachers in the school, at least one of them will be an EMT, a past EMT, working up. This is how you work up to your teacher. You take jobs, you become an ENT, then you get your tertiary degree. You go from there. There are courses involved that you have to do as teachers. So the ridiculous argument comes upon, why don't we have nurses in schools when you already have nurses and doctors in schools? Care ethics is a part of teaching. Okay, so a broader argument comes out of this thing. We're funding as we're funding and that's just the truth. I've had people argue with me for days now about this thing, and it's just boils down to the truth. The truth is these people are qualified to be nurses. Now, with how I pose this with the California teacher strike as an administrator, I would say, okay, we're going to open up two nursing spots for two teachers, and we're going to settle raises too. And every school in California will, any teacher that goes to a 90-day fast track to nursing course, and you can do that because they already have most of the courses. You take a 90-day fast track to nursing course and you get a raise. That's a merit raise. That's what I call a merit raise. If you do this course, like I've done courses in my life, I've had to take courses for things that I didn't want to take courses for. But to get the job, and to get the raise, I needed to take a course. And teachers are no different than anybody else. There's some special mentality on teachers where I'm a teacher now, and you're just going to pay me like $100,000 a year. No, that's not going to happen because that'll break the system. What we want to do is we want to merge teaching with healthcare and merge healthcare with teaching. And you see this all over our country. And then we get these facilities that actually work. Now, the question also often in America is we've got 30 million people without health care, and probably 14 million of those people are children. So if you offered the 30-day, 90-day fast track to two teachers, which already have the education to do it in 90 days, and you put a healthcare facility inside of schools and all kids go to facilities and schools, they would then have what? They would have healthcare. They would have healthcare. Now, if you opened up those healthcare facilities within the school to make a little money, this is merging. This is merging already existing facilities, which you and I pay for. That's why I always say we shouldn't have a health and human service community because we already have the library. And the library always has computers, and it should be a computerized system. We can lay off the health and human service people. They can go out into the private industry, into healthcare or teaching or whatever they want to do. And we already have these things solved in our community. But we get this self-defeating attitude by a lot of teachers, and I hear these arguments over and over and over again. And I heard them back in the day, and this must have been 10, 15 years ago when we did this argument. The administrator, what it was, they put on a small skit. The administrators came in and they said, and then someone pretended like they passed out, and then all the teachers and all the doctors and all the whatever were sitting there. And then the teacher stood up and said, is there a doctor in the house within this community meeting that we have? And 4 doctors stood up and they said, is there a nurse in the house? And 3 of those teachers that were nurses before they were teachers stood up and they said, look, we already have nurses and doctors in the building. Why can't we utilize you? Why can't we give these people a raise that deserve a merit raise? And if anybody wants to get that raise, we can put you on a 90-day fast track to get that raise. And then you all become teaching healthcare officials. And that made much more sense. And that made a lot more sense than doing this argument about why you simply deserve a raise in this world because you are a special person. It's merit based. We argue these merit based raises, and we argue this merit in society all the time as MGTOWs. And as a matter of fact, as MGTOWs, this is the merit argument playing out in society. This is the merit argument playing out in society for bigger issues. All roads lead back to some things. When we have these arguments about teaching officials and union positions and higher education positions in schools in California's, these have threads that reach out into our community. And then as we look at these threads as sociologists, we look at how fractured our community really is by hate, self-defeatism. These teachers could be much, much more. And that's what I say, be all you can be. Take the 90-day course if offered. And that's something I would pay for. Take the 90-day course if it's offered. You already have all the credentials. If you have a bachelor's degree or a master's degree, you already have most of the credentials to do this in 90 days. And then you could become a better part of our society, in a society that hinges together, that weaves together. But as a sociologist, we look out at these issues, and then I can see that where are the spots where it's fractured? It's fractured with ignorance. It's fractured with these ideas that I'm a special person, that I deserve more just because I'm me, and I know how pretty I am, and I know how bright I am, and I'm just me, and I'm so special that the world deserves to give me money. No, I have to earn that, and I have to present myself as something that's useful in this world, and that's merit. So we look out as these unfolding arguments within our society, within California, and I think, man, maybe there's something in the water there, where these people, we did this argument in Ohio years and years and years ago, maybe up to 10 years ago, and as I explained with a small skit, with the idea that you already have the education, there's a care ethic. There's a care ethic, which is nursing, which is already indentured into teaching. And all we're asking these people to do is do your job. You've already taken the courses. You are already a person that's responsible for the care ethics of the children. The minimal requirements of the CDA is that you have CPR, you have certain knowledges of diseases, and you have certain knowledges of how to use a freaking thermometer and how to administer. Now, one of the arguments was from Jank on TYT. Says he sent his kid to school with a prescription, and they said, "Oh, great, we have a teacher, a nurse on staff twice a week." And I was thinking, that's so ridiculous, because every teacher in that school has the qualification to administer that prescription to that child in a timely manner during the day, or else they're stupid. Every single teacher every single person in that school, from the janitor on up, can go, "Okay, little Jimmy, it's time to take your prescription." And that's a care ethic. You're not prescribing the prescription. You're simply administering at a certain time of the day. Every single person, with a CDA, a teaching certificate from the lowest level, has courses that sometimes translate over into healthcare. Most of the time translate over into elder care. And that when you're doing elder care, you're doing the same thing, and you've already taken that course. How to change an elderly person, how to get them their prescriptions on a schedule, how to cook for an elderly person. These are minimal requirements of a human being. Minimal requirements of a human being. And these teachers are so emboldened and are so entitled that they don't think they have to present minimal requirements of a human being towards those children. And that's where it gets insulting. You're already the nurse. You're already the doctor. Now, with this idea, we put these healthcare facilities in schools or on the side of schools or some area within the school, and that becomes a public healthcare facility for all. And we've answered a question that's tantamount to our entire society. We have 30 million people without healthcare, without basic healthcare. Now, if the teachers would simply learn their positions, and a facility would simply open up in every school, in every portion, in every county, in every neighborhood in America, healthcare would be free for all. So we answered two questions there with this small question of why you deserve a raise. Why do you deserve a raise? That's what I ask. What makes you so special where you deserve a raise? And then they come up with this silly argument, the silly side argument of we need more nurses in the schools. And I agree, yes. But you are the nurses. You are the doctors. You are those intelligent people. And I know that sounds oh, that's just more work. Of course, that's what work is. You go to work and you do work. If you want a raise, you have to do more work. What is that work that we want you to do as teachers? Well, we want you to provide the minimal amount of care ethics to our children when we send them to school. But it's self-defeatism. They say, no, that's more work. And they complain and they bitch. And that's idiotic. And that's idiotic. And I cannot believe I'm hearing this argument from them. People that are well briefed in logic, people that are well briefed in philosophy and care ethics, people that should already know these things are teaching our children, and that's why they don't deserve a raise, because they don't know these things. Hello, Joey. Hello, Busto. Hello, Daria. Hello, Hondo. Hello, Buster. This is a subject that's touchy to us all. This is a subject that drives me up a wall when I hear how teaching administrators and teachers that have bachelor's degrees and up think with very little logic. And I'm wondering, how did they ever get that position? I often look at the janitor. And the janitor has to have a course in bloodborne bacteria because he has to clean up puke from kids all day long. They leave blood and they leave puke. So he has to be an electrician. He has to be a plumber. He has to be a healthcare official. He has to be a lot of things. That simple janitor down there in the basement has to be all those things. And they can see that because somehow he is less than them. And they treat him that way. And he probably has more of an education than him, and they just don't know it. That's why I say the janitor is the smartest guy in the school. Just ask him. Just ask the janitor what he would do, and he'd probably tell you the same thing I would tell you. All these teachers around here, they're doctors. They have master's degrees. They've already worked in healthcare. They're already nurses. All we need is to connect them to that facility, because a nurse is not a nurse without a thermometer. That's logic. But the janitor down there, he's already taken a course in electricity, which is logic. Ands, ors, and nots, everything must run to a true. Sometimes it's embarrassing living in America. Sometimes it just drives me off a wall when I see this argument between the left and the right, and I see the argument between the administrators and the blue-collar people, and I'm thinking, man, are you all so stupid? Because we have the social dynamics of a community to worry about, and how all these threads branch out into the larger community, and we wonder why these things back here these things back here have a hard time functioning and we have a hard time paying for them. It's this ridiculousness and this simple logic that plays out into a bigger issue. That's why our communities don't work. And it's why communities in Africa don't work. It's why communities in South America don't work. Because because they've never put the interstructure together. That's why they call it inner structure. The threads reach out. Every one of these positions touch every other one of these positions, and we live in a community, but they make it a horrible community to live in, where people like me actually go galt on this thing because I can't stand the anti-logic in my brain anymore. And that's what I wanted to talk about a little bit. And I know my rant is harsh. And I know someone's going to say, Traversable. That argument is crazy. You're asking people to do more. No, they're asking for a raise. Of course I'm asking them to do more. Any business executive in the world would ask that. Oh, you want a raise? You guys want a raise? Okay, I want more. Busto Gundo, that's true. Wouldn't it be nice if every American could walk down to their local school, which is about 75 yards that way, and get the minimal amount of health care provided by healthcare professionals, which we already have? Early detection on certain diseases. We can have early detection on this. Instead of some huge industrial complex that runs like shit, like Theranos, that you have to go down and it costs you $200 for a simple blood test after you paid for your insurance already. No, these things are so simple. Let's get back to a simpler society where we have simple, basic things next to each other. Education, schooling, healthcare are all the part of the same system. All I'm simply asking is for these people to acknowledge that and work together. And when they start working together, maybe we'll get something done around here. But it's a simple step in logic that they need to take. Daria asked, do you think they overcomplicated healthcare so they can steal the money? Yes, I do. I think administrators in this, back in the day, we had the Kaiser program, and the Kaiser program was about disallowing people. That's what it's about. It's about disallowing people, and it became the idea of this is a pre-existing condition, and this is that, and this is why it can't. They became masters at this trade. Insurance companies they hired people, they coded everything, and they made everything codes, and they hired these people that are masterful in disallowing healthcare. Because if you have to give out healthcare with healthcare, man, that takes from the money you're earning. That's the way they think. Now, in my humble opinion, I think we should have one single payer. I think we should have Medicare for all, and that's Medicare, not Medicaid. Nothing's free in this world. Everybody pays in what they can pay into this thing, and some people pay more because they can pay more, or some people can't. But if everybody was on the same plan, it would be maybe a minimal $90 payment a month, which is highly affordable. But if we all work together, it's the same idea they've been posing in healthcare groups forever. The more people we have in our group, the less the healthcare costs. But we have to stop these thieves within our community, and we have to grow healthcare in other places, like I was talking about today. if you had a couple nurses and teachers took responsibility for their educations and became those nurses, you would have a healthcare facility in every school that would give healthcare to 14 million kids. 14 million kids just by a simple act of demanding a 90-day fast track to nursing out of qualified individuals. And then you give them a raise and say, if you want to, here's how the system works. If you want to get a raise, take the course, and then you will be a qualified individual. And then we'll cure two problems. We hit two birds with one stone. And that's always a good thing. A win-win is always a good thing. But as long as we have morons and special people that are demanding that they just get a raise because they're so special, that's where this becomes socialism. That's where this becomes communism. That's where this thing becomes predatory capitalism and all those horrible things that you hear about. That's where we divide our, that's where the division in our society comes from. They talk about the welfare queens and they talk about this and they talk about the poor. That's just a division in society. We could take care of that all in one swift action by making our communities work together, our systems work together. And this California teaching argument, I see as a big opportunity in America to get something right. But they won't. You know why? Xenophobia, all those things, classism. There has to be a lower class of people, and they have to be a part of a higher class that aren't demanded to do the same amount of work. And that's what makes me a Maoist in a way. Everybody does 8 years on the farm, no matter who you are. That's from the president down to the janitor. You do 8 years on a farm. But entitlements and people like that, we talk about two kinds of entitlements. We talk about that. They'll say, oh, these people want healthcare for free, and they want money for free, and they want to have babies for free and all that stuff. And they'll say that's the entitlement. On the other side, I see this entitlement where they don't have to do the work. They get free raises. They get all the money. They get to live in the big, beautiful houses on the shores of all of our lakes and all of our desirable communities. And they don't have to do no work. And that's what they're saying. I don't have to do no work. I'm better than you. That's entitlement too. Entitlement, entitlement goes both ways on this thing. And that's what I see in the teachers' unions right now. You already have an education. You've been afforded an education by one of the greatest country in the world, the United States of America, that afforded you this education, the best education possible. And you want to complain? And you don't want to work with that education? You don't deserve it. And if you got an education in this country and you don't use it and you don't expand on it, then you don't deserve it. And teaching's already, it's always about teaching. And that's for you to continue growth. Take that 90-day course, offer a 90-day course to nursing within our schools, and then put in those facilities of healthcare and open it up to the public. And then those 30 million people without healthcare would have healthcare. And it's simple. It's so simple. Maybe it's so simple that it just goes right over their overthinking brains. We have so many problems in this country, so many problems. Like you said, the average apartment costs $700 to $1,200. That's feudalism. Them same rich people are entitled to take money from the proletariat that built those apartments. We have feudalism. We have entitlement in our rich and our upper classes. We have simple teachers, simpletons, arguing simple subjects they can't figure out. Maybe they paid no attention in school. They never deserved to go to school if they didn't pay attention. We should have free education. We should have basic housing and basic health care and basic utilities for people. I watched a man freeze to death. They turned off his utilities because he couldn't afford them. I watch homeless people freeze to death every year in my community. They take them out. They call them homesicles, homelessicles. They're homeless people laying on benches that freeze to death because they probably already had pneumonia. And that goes back to the healthcare issues. And these things are easily solved. You got to take greed out of it. You got to take entitlement out of it. You got to be a selfless human being. The minimal requirements of being a selfish human being. I think I talk about this with Schweitzer all the time. The minimal requirements of being a selfish human being is not portraying casual cruelty to your people around you. That's why I push that point. Don't be one of these casually cruel morons on YouTube that have the snarky argument for everything. Be the guy that's right. Be the guy that has a logical, humanitarian argument. And I don't care what side of the aisle that falls on, whether you're on the left, whether you're on the right, it doesn't matter. Them are insignificant arguments of tribalism. Lately, I've seen objectivism go to hell. I've seen skepticism go to hell. All through this tribal mentality. Let's separate and divide as the masses go hungry. I even seen some moron project this week that get rid of the basic amount of food that we give to people through our own altruism. Let them starve. They'll just find a job and go to work after they go hungry. That was his analogy. That was such a casually cruel statement that I can see the evil of Eichmann in that casually cruel statement. I can see what Hannah Ardant was talking about, the iniquities of evil all around us. Now, there should be some measurement, some bar of basic humanity. And then I see it in my program here. Something we pride ourselves on our logic. We see these casually cruel people sniping at every other word is cynicalism and sarcasm and keck and skepticism and objectivism that come out of their mouth, but they don't truly understand any of those philosophies. They attach themselves to something greater than themselves and ride that wave. Makes me sick. This whole society makes me sick. And they ask me why I go galt, why I try to remove myself from most of the people out there. Why I don't invite people in my house. Why I value my solitude. Live long enough on this planet and you'll live long enough to value your own solitude. Yeah, I wish I lived in Alaska. I was looking at Pernicki. What was his name? The guy that built the cabin up. I was watching some of his videos. I can't remember his first name, but I know his last name was Pernicki. He lived out solitude and he loved it. He was happy. He got in touch. There's only 745,000 people in Alaska. Like, wow. Wow, one of the biggest land masses in the world, and there's only 745,000 people that live there. Factual. Factual. I was looking at a little strip of land going down from the Alaska. Has a little dip that goes down, and it runs into British Columbia, and right at the edge of there's islands, and there's the weather's quite not nice. I would say nice for me. It doesn't get cold. It doesn't get hot. Uh, it's wet a lot, and it's 40 degrees a lot. But but there was a lot there I was looking at. It was 14K, no taxes. No taxes, 14,000. I could build a cabin on it. And I was like, wow, man, I might have to fight a few bears with my hammer. I might have to fight off a few wolves with my hammer, but I think I'm up to it. And that would just be some badass stuff anyways that I kind of like doing. But I'd be away from people, and people which bother me. They can't it's man, I don't know what's in the water in America. It makes them casually cruel. It makes everybody snarky, and it makes everybody skeptical, and they look at objectivism the absolute wrong way. The Warhammer. Got to get yourself one of these, Joey. These things are great. This is home defense. Guy tries to break into your house, and you run out with one of these, and you go, uh-huh. He just looks at it and runs away. It doesn't even need a bullet. It just looks badass. I always say that's my first line of home defense, the scary hammer. First line's this and these big arms, and then that may be the second line, my hammer. I walk out like this and you run. I used to strap that to my bike because of all the dogs. I get bit a lot, and I wear cloth around the bottom of my boots, up from my boots on my bike for a reason. I put 2 layers of cloth, and I wear long socks, so it's actually like 3 layers into my boots, my bike riding boots. I have a special pair of bike riding boots because I get bit almost every week by a dog. I used to have to carry the hammer, and I'd be like, "Get away from me." Hello, Magnus Online. Hello, Joey. Hello, Al. Estrogen in the water. That was my analogy for a while. It must be estrogen in the water, which makes these educators really just kind of, I mean, what is it about the educators in our community where they can't put a simple logic gate together and put systems together? These people are paid to teach children how to think of, in a communal way, to put systems together in a head. You got healthcare, you got basic needs, you got it's Adler's hierarchy of needs or whatever that is. I can't remember which hierarchy of needs that. It's a hierarchy of needs. You got these hierarchy, and you're supposed to teach children this hierarchy of needs, and they can't even put together simple systems for themselves, or better yet, have logical arguments that figure out simple arguments within their own community. It's like, wow, did you guys miss Plato? That guy was great at that shit. And I think that's what the administrators did. They introduced this idea of nursing. It's like, here we got the nurses, but all you educators already have nursing degrees. And if you don't, we can get you a simple nursing degree and a 90-day fast track. You want to do that? You want to earn your money? And then we make all the educators into healthcare administrators. And then we solve 2 problems of healthcare in America and getting them raises and teaching our children and having a basic amount of humanity in your school where you think about care ethics for these children that you're responsible for in your school, that you're forced to come there. Now I can see the argument of, I'm not sending my kids to those schools. These teachers are awful. Most of them are. I go up and talk to the administrator at the school around the corner here. It's We talked about it before. It's a we had the great author Helen Steiner Rice here, so it's Helen Steiner Rice School, and I could talk to the administrator and about issues once in a while. It's like these issues, and we talked about this subject. We went through this subject in our community about nursing in the school, and that's the same argument that played out. You're already people that are responsible for care ethics. Now, tragedy is a different thing. If there's tragedy and trauma, that's not your fault. That's where you call 911 and you go, there's tragedy and trauma, and we need an ambulance, ambulatory services to take them to the healthcare officials that are prepared for those things. But while they're here, you try not to have them get facial injuries or head injuries, and you try to you look at them in the morning, and you look over your class in the morning. Oh, there's 30 of them. That's not too much. Really, you can look over 30 kids and say, are you sick? Are you sick? Are you sick? And better yet, anybody have any aches or pains, raise their hand. And this would be too much work for them. This is asking them to do 3 minutes every day, asking questions of the kids and being observant of the and aware of the kids around them, that's why they're there to teach these kids, asking them to be observant of every one of those kids' needs is too much trouble. I laugh at these teachers. Horrible people, and they wonder why. They wonder why you're horrible. I don't know what makes them that so narcissistic, that makes them that so self-interested. They make good money. They only work 8 months out of a year. they get more days off than I've ever seen while I was in industry. They got great benefits. They get a vacation through the summer, and they're complaining. What are you, idiots? Man, I'd love to do that position. So I could be around a bunch of fabulous little kids all day. These kids are great. I just couldn't smoke in a classroom. That'd be tough. Kids are great. I couldn't imagine putting me in a bunch of kids, and then me complaining about that. 30 kids. Give me 40 of them. I'll take 50 of those kids, and I'll teach them math and science, and I'll teach them baseball. And I'll teach them a lot of things, sociology and history. And they're going to love it because I love kids. I love my kids too. They're great. They're funny and intelligent. They got more neurons than adults would ever have. They have 100,000 to 100 million more neurons than any adult has. They pick up things like that. They're sharp and they're funny and they're great. And you get to be around them people, them special little people all day, and you're complaining. Something wrong with this society. I think it's the teachers are so skeptical and narcissistic and demanding nowadays that they make it suck for themselves. Most people, you just ask them, you want to be around, you want to teach a bunch of kids? Yeah, I'll take that job because I love kids and they're great. There's two ways to think. And if you don't have that attitude, what are you doing teaching? Go get a job in the private sector or the business sector. Jesus. If you're in a job that you hate, then please leave. And if that's teaching, please leave. Nobody wants them kind of teachers around. And if we have to educate more teachers, damn it, let's do that. Let's make everybody into a teacher. Let's raise the educational bar so every person in America has a teaching degree, the basic CDA. Problem solved. We all become our own doctors too. Christ. It's all about education, and I believe in education, but I believe in humanity. I believe in man treating people nice every. That's why I tell you guys every day, do this for yourself every day. When you go to the store, you go to the when you go to the store, you go see your friends, or you go out to the convenience to pick up some milk or your smokes or whatever you're doing, or the pizza delivery guy comes. Tell him what a great job he did and tell him how you appreciate that. Lay it on thick too and let him know he's the greatest person in the world. That's not for him. That's for you. And when you figure that out, you might be a MGTOW. You might just be a MGTOW after you figure out why that's for you. Casual cruelty sucks. And most of the people in the world are just that's why they're not good at argumentation either, because they automatically introduce casual cruelty. I refuse to do those arguments anymore. That was my decision not to monitor my chat. I refuse to do those arguments with people about how casually cruel I can be to you on the internet. I refuse to do that because I lose a little bit of my humanity and you lose a little bit of your humanity, and it makes us all look stupid. So I said my piece, and it'll be very unpopular amongst anybody that listens to it, but I think it's all up to us to be better people. And I think my group resembles that. And like always, it's always up to each one of you guys to get out there and be better, be happier, be a fun person to be around. Don't be such a stick in the mud. And that's it. That's my program of MGTOW. And all low roads lead back there, and we can solve all the world's problems if they quit being so. Ugh. Ugh. I don't even know what to call them anymore. But I'm done here today, and I'm done talking, and that's what I wanted to talk about: the teacher strike. And why it's just so neurotic to me. It's lunacy. And like always, man, it's up to you. Thanks for coming around, and most of all, thanks for being MGTOW. MGTOW.